So yesterday we talked about S11, S12 and S-LAS. So small revision will do. So basically in S11 we have 10 plants, Melsilla officinalis and Lobila inflata. These are the main plants which are added in the S11. So basically it will work on central nervous system and peripheral nervous system, but mainly on vagus nerve. Okay. So there's the reason this remedy is named as anti-vomiting remedy or anti-emetic remedy. Okay. And also used for mucous membrane degeneration. So wherever mucous membrane is present, the inner lining of digestive system, in the respiratory system, we can use S11 to regenerate the mucous membrane. So which are the best remedy you can use with S11 is F1, L1, A2, WE and YE. So along with S11, you can use S11WE or S11YE according to the condition. When we study about electricities, we will able to know which electricity we have to select. Okay. Next, here we have the S12. S12 have 8 plants in that Euphrasia officinalis and Atropa belladonna. These are the two important plants which are used in S12. So there's the reason it is perfectly work on eye diseases. So if you add F1 along with S12, this remedy will also work on optic nerve. So basically S12 and electricities we can select according to the condition in WE, BE or GE. These three electricities you can use. Next we have S-LAS. S-LAS had two plants only. Okay, Gentina lutea and Hydrastis canadensis. Okay, so in that we will use for anti-constipation to relieve the bowel movement. Okay, and we have bunch of nerves in our intestine, so it will activate those nerves. Okay, so basically what will happen, the patient whenever we will into depression, okay, and anxiety, okay, any mood issues, okay, whenever his mood disorder occurs, okay, so what will happen, the nerves which are present in the intestine will have low flow of connection, okay, with the intestine. So what will SLARs do? SLARs not only improve the functions of the intestine, as well as it will improve the connection between nerves and intestine. So then the depression also be gradually cured, which will relieve the stress from the body. Okay, so there's a reason we can use SLARs for anti-constipation. And as well as if you want to use SLAS along with C10, it gives best results in any type of piles. So there's the reason we will use C10 SLAS, which will give perfect result, okay, in any types of piles. So this is all about S group. So it started with S1, S2, S3, S4. S1 will work on digestive system and glands. Okay, but mainly is lymphatic temperamental remedy. Okay, and S2 is work on genital, okay, glands, genital of female reproductive organs, and mostly on glands. Okay, and S3 will work on genital, urogenital organs and specific for male remedy, and also work on mucous membrane. Okay. S4, it's a hereditary remedy of glands and female. S5 is first metabolic remedy and as well as bilious temperamental remedy. And also work on muscles, any types of muscles. Okay. S6 is specially designed for kidney, urinary bladder. Okay. It want to purify the blood and lymph. S7 to improve the lymphatic flow for digestive system and glands. Okay, S8 to give the nutrition and to improve the quality of the lymph. S8 you can use. S9 to regulation of metabolism. Okay, S10 is the second metabolic remedy after S5. Okay, and also used with WE and after recovery from the disease, if any weakness or tiredness, to improve the overall quality of the body, you can use along with S1. So S1 and S10. So these are the remedies we used in, these are the remedies we talked about, all the 12 remedies, 12, 13 remedies. So in the 38, we completed 13 remedies. Sorry, in main remedies are 9 only here. Now we'll talk about other group, that is lymphatic group. Okay. So here now today we'll talk about lymphatic group. Okay. So basically in lymphatic group we have L1 and L2. L1 is original remedy, L2 is compound remedy. Okay. So L1 basically we know that we have two types of manufacturers. One is blood manufacture and another one is lymph manufacture. So basically we have two groups. Okay, lymph manufacturing to improve the functions and structures of lymph manufacturing organs and to improve the functions and structure of blood manufacturing organs. So basically, we have two groups. That is, one group is lymphatic group and another one is angiotensin group. So lymphatic group will work on uh, lymph manufacturing organs. So lymph manufacturing organs. So lymph manufacturing mean lymph producing organs. Simple. Okay. What we call lymph producing organs. So any issues in lymph producing organs, okay, so we can treat with L group. So basically L1 had 8 plants, okay, 8 plants. So basically I want to talk about lymphatic group. So basically whenever lymphatic organs or lymphatic channels, lymphatic organs that purify the lymph and blood are mostly involved in the disease. Okay, and mostly chronic diseases will seen in lymph. Okay, so basically, so whenever we want to treat, so we have to add L1 in that remedy. So along with other remedy. So if the person is belongs to lymphatic temperament, we already know that we will add S1. Along with S1, if we add L1, what will it will do? It will also enhance the functions of lymphatic organs or lymph producing organs. So basically S1 LN1 is the best combination to improve overall manufacturing functional capacity of the limbs. Okay, so that is the reason we have to select L1 for lymphatic temperamental patients. And other patients, other than lymphatic patients, we have mixed temperamental patients. Their problems will start from sanguine and end up with lymphatic. So we have to see whether the patient is in sanguine temperamental diseases or lymphatic temperamental disease. In that issue also, you can add L1 to the patient, S1 L1. If he comes under lymphatic temperamental diseases. Okay, so what are the organs which produce lymph? Already we know that. Okay, we talked in detail in temperamental session, but here I will revise all the organs. We have pituitary gland. We will know it in short, pituitary gland. Okay, and another we have thyroid. Okay, and we have thymus. Okay, we have renal gland or adrenal gland. We have ovaries. Okay, now we have testes, and we have pancreas. So all this seven organs belongs to lymphatic production. So if there is any issues in this problem, in this production of limbs, you can add L1. So I will give example. If the pituitary gland doesn't work properly, so what will happen? All the other other uh, other glands also doesn't work properly. So we have to improve pituitary gland function. So we have to add L1. Basically, L1 directly work on pituitary gland. It will improve pituitary gland functions. Okay. But if you add S1 along with L1, because S1 is designed to improve the functional capacity of all the glandular organs. Okay. L1 is specialized only for production of lymph. But S1 is overall function of the glands. If S1 doesn't work, you have to add S2. So S1 along with L1 will work on pituitary gland as well as thyroid gland, thymus gland, renal gland, ovaries, okay, testes and pancreas. Okay. So we have to select like that. So L1 will work on all these types of lymph manufacturing glands. So now we will talk about how many plants are present in L1. Let's discuss here. So we have Erythria centurium. First plant is, so basically we have eight plants. How many plants? We have eight plants in L1 lymphaticus. The L means lymphaticos. Okay, this is the full form of lymphaticus. So we will call L, L1, lymphaticus. Okay, in this we have Erythria centurium, first plant, and second is Humulus lupulus. Okay, Humulus lupulus. This is the second plant, and third one is Pulmonolia officinalis. Okay, and fourth plant is Menianthus trifoliata. Okay, Menianthus trifoliata. Okay, and fifth plant is Oxalis acetosella. Okay, Oxalis acetosella. Eight. And sixth plant is Cymaruba amara. Cymaruba amara. Okay, this is the sixth plant. And seventh plant is Echinosia agostifolia. Okay, Echinosia agostifolia. Echinosia agastifolia, and eighth plan is Fucus vesicoliosis. Okay, Fucus vesicoliosis. Okay, so these are all the new plants which are added in the L1. Okay, which will work combinedly on lymph manufacturing and as well as lymph drainage tract. Okay, so that is the reason we will add L1. Okay, L1 along with L1, I told you S1 is best, but along with L1, you can use C1, C5, okay, and C2 also, C6, And C15 basically because all this work on metabolism, BE and GE. These are the best remedies along with you can use with L1 electricities. So these are the remedies you can use S1, L1. Okay, I prefer because of the why the I prefer S1. And we have C2, C1, C5, C6, and C8. And B and G. Okay, so these are the remedies you can use along with L1. So this is all about L1. Next we have L. Next we have L2. So basically L2 is a combined remedy. Okay, so we have combination of S1, L1, and A3. So we already know about where S1 works, where L1 works, but we want to know that A3 here. So already we'll go to talk, we'll know about A3. So basically, this is the master remedy for all types of fluids. Okay, fluids. To improve the quality of the fluid, to improve the flow of fluid, okay, to improve the purification of fluid, okay. So it is the master remedy of fluids. What I can tell you, master remedy of all fluids, not only lymph, but also blood. Master remedy for all lymph and blood. So there's the reason. Already we have S1, L1, and A3. So there's the reason Dr. Count Caesar Matti skipped L2 from the list. And mostly, I told you the master of all types of fluids. So you can use in anemia, okay, iron deficiency anemia, all types of anemias you can use. Or you can use if any types of fluid accumulation in the glands, or the glands are enlarged. So basically the fluid is accumulated there. So at that reason you can use uh, S1, L1, A3. Okay, separately you can make L2 directly, or weakness, generalized weakness, you can use. And I told you the glandular enlargement. Okay, and we have discharges, white discharge. Okay, this is also very good for white discharge because the fluid, master of fluid, I told you that. So there's the reason wherever fluid is coming without any specific reason, so you can add S1, L1, A3, licoria. What you can add, licoria, and weakness after fever. Okay, weakness, generalized weakness, and fever weakness. Regular, you can tell a regular remedy also. You can use S1, L1, A3 regularly in D5 to maintain all the body, all the body fluids in equilibrium. So it is the master remedy of fluid. It maintains the fluid levels normally in all body parts, and it will work on enlargement of glands, and also work on liparia, and also work on general weakness. Okay, so wherever you get that the problem is in the fluid, so you can add S1, L1, A3. It may be blood, it may be lymph. So this is the general thing you have to remember. Okay, next we have another group, that is angioticus. So let's start angioticus group. One second. So now we will talk about Angioticus. Angioticus. So basically in that we have A1, A2 and A3. These are the three remedies, only three remedies he added. Dr. Count systematic. Okay, basically when he invented, he saw mostly lymphatic temperamental patients. Okay, but in Asia, mostly the patients belong to sanguine temperament. Okay, and another thing is that mixed temperament and mostly nervous and as well as bilious temperament. Lymphatic temperaments also there, but we can see they are less in percentage, 20 to 30% mostly. But nowadays, due to the uh, sedentary life, the patients are normally a sanguine temperament, but they are becoming lymphatic temperament due to the sedentary life and sedentary food and whatever food we are taking, they are not healthy for us. Okay, but only for our who complete the hungry, not for health. I think so. Okay, so let's talk about A1. So A1, I have to tell you about A1 that A1 angiotensin group is basically made for blood constitution or blood temperament. So basically, here you have to remember that wherever blood manufacturing, blood utilizing, blood purifying organs are disturbed, so you have to use A group. Mostly blood manufacturing. Blood manufacturing units are disturbed, so that's the reason you have to select from that A group. So which remedy you have to select, that is purely depend upon the diagnosis. So if you do diagnosis properly, you can get which remedy you have to select. Okay. Now we'll talk about the blood manufacturing organs. What are the blood manufacturing organs? One is liver and another one is bone marrow. And utilizing blood utilizing or blood pumping organs are veins, arteries, heart, okay, and other than that, nerves and brain, okay. They are utilizing, they are supplying, okay, they are producing, and we have purifying organs are lungs and kidney, lungs and kidney. Okay, so basically A1 will work on this things mostly veins, arteries, and heart. Veins, arteries, and heart. So let's talk about A1. So basically in A1, we have 6 plants. What are those plants? One is Arnica montana. 6 plants we have. Okay. One is Arnica montana. Okay. Another one is Avina sativa. Okay. And another one is Capsella bursa. Capsella bursa. And fourth one is Malva sylvestris. Malva sylvestris. And fifth one is Sanguinaria canadensis. Sanguinaria canadensis. And sixth one is Hydrastis canadensis. This is the old plant which are also used in S1. So these are the 5 new plants. Okay. So totally we have 6 plants. So this is mostly work on blood producing organs, but concernly blood circulating organs. Okay, it will work also on blood producing organs like liver and bone marrow, but mainly concern on blood circulating organs. So circulating organs, mostly we have heart, veins, and arteries. This is the heart, this is the artery, this is the vein. But in that, it specifically work on left side of the heart. Left side of the heart. So what is the left side of the heart? Left side of the heart have oxygenated blood which comes from the lungs. Oxygenated blood, O2 blood. So it will enter into the arteries, vena cava, sorry, aorta. So mostly A1 will work on left side of the heart and mostly it will work on arteries. So first, uh, combinedly it will work on blood producing organs, blood circulating organs. If we to select from that, we have to select left side of the heart. If we select left side of the heart, it concernly work on arteries. So this is the specific function of A1. It mainly works on arteries and left side of the heart. If a person have any problem in his blood producing organs like liver and bone marrow, so select A1. If a person have problem in left side of the heart, any valve damage, aortic block is there, or we have ischemic heart disease, okay, or then you have to select A1. If any problem in arteries, erythrosclerosis, or any disease, hypertension, you can select A1. Okay. So in all these conditions, you have to select A1. A1 is the best remedy for left side of the heart, arteries, liver, and bone marrow. Okay. So you can also select in anemia also because we have oxygenated blood. If there is a problem in the oxygenated blood, we have to select A1. Okay. So today we talked about A1. So basically, which group remedy is best along with A1? So again, the A1 is not a specific, it is a specific remedy. Okay. So where the problem is there, you have to select along with that group. Please remember, this is very, very important. Okay. Whenever, whenever a problem is present in specific area, like example, a problem present in pancreas. If you want to increase the circulation to the pancreas, so what you have to add along with S2, S2 is the glandular remedy. Along with S2, you have to add A1. Okay. Again, another example, kidney. You have to improve the purification process to the kidney. Uh, Kidney needs more circulation. What you have to do? You have to add S6A1. So likewise, you have to remember that wherever circulatory problems present within the arteries to the organ, so you have to select that group along with A1. So S group, you can use with L group to improve the lymphatic flow, lymphatic circulatory flow. Already we have S1, A1. But here, the production of lymph, to improve the production of lymph along with L1, you can add A1. In F group also, to improve the nervine circulation, you can add A1 and electricities because you have to improve the circulation or you have to decrease the circulation. You have to increase the circulation, add with RE. If you want to decrease the circulation, add with YE. So this is the basic concept. Okay, and bleeding. Bleeding also is there. During bleeding, you can add along with B. So it will stop the bleeds. A1, YE, BE. This is the basic combination of, oh sorry, A1, not YE, A1 plus BE, which stops bleeds in mostly D6. Okay. So I think you understood about A1. So today we talked about L1, L2, and A1. So any doubts, please ask.